Hello and good evening. I'm Melissa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. I'm here at the Drug Policy Summit Malaysia, where experts and policymakers are discussing if and how the world should rethink its approach to drugs. Now, joining me on the show to discuss this further, to explore what's changing and what's not in global drug policy, I have with me Professor Alison Ritter, who's Director of the Drug Policy Modelling Programme at University of New South Wales in Australia. Alison, thank you so much for being on the show with me today. So, I think for decades now, as you must know, also the global drug policy regime has been shaped by the war on drugs, the so-called war on drugs. But we're here today at this summit where we're rethinking or maybe even considering the potential for reform. We have countries around the world experimenting with decriminalization or legal regulation. Do you think we are now witnessing a real paradigm shift when it comes to prohibition? Is that the trend, the thinking nowadays?
Thank you very much for having me. I think there's definitely a global trend away from strict prohibition. There are more than 50 countries around the world that have changed the way in which they respond to drug use. And we're seeing many places recognising that the economic cost of treating people who use drugs as criminals is significant and not worth it. It's not a good economic investment to treat people who use drugs as criminals. It is much better to provide them with information, harm reduction, healthcare, social support. That's much less costly. Healthcare is cheaper than policing, and it's more effective. So when you combine less cost for government and a more effective approach, it's kind of a no-brainer to start to think about drug use as a health and social issue.
Okay. When you say it's more effective, talk to me a little bit about that. So with 50 over countries that you said that are changing their policies around their drug policies, the outcomes, what do we know about that? What does the latest data tell us about what is actually working?
Yeah, so this is for people who are using drugs. Yes. We know that providing a treatment response for people who are dependent on drugs, about a third to a quarter of people stop using altogether. A third go back to using drugs, and a third use less or use less harmfully. Wow. So and generally we know those are the outcomes from providing treatment. Sending someone to prison, 100% of people resume drug use. Almost. I mean, there are the rare exceptions, but sending someone to prison is not a way of changing someone's behaviour. For the time they're in prison, they may use less or none, depending on your prison system. Many prisons have a lot of drugs in them, as we know. But when you come out of prison, you haven't learned any new skills for how to be in the world without using drugs. All you've learned is that you've done something wrong, you've been criminalised, you're likely not to get a job, you're likely to have problems with your family. None of that helps with dealing with drug use.
Right. So we have that evidence now. That data has been research has been that's evidence based. Has that changed the conversation? Has that changed policies? Yeah,
well, I think Malaysia is a really good example where for the last 3 years there have been really positive conversations with the Ministry of Health, with the AADK, with the police, looking for ways to improve things and try and not have such a criminalised response to drug use. So even here, this is a really good example of that conversation evolving.
Okay. When you work with governments, with stakeholders, with law enforcement, may I ask, when you present these clear evidence of improvements of effectiveness, of harm when using when criminalizing people who use drugs, do you find that it changes their minds, or is it still quite difficult to move away from from punitive models?
Well, I think evidence is really important, but it's not the thing that changes people's minds. So we can have all the evidence in the world about something, but that doesn't mean policymakers are going to implement that policy. So you need more than evidence. Evidence is an ingredient, but it's only one. I think the other ingredients are to do with values and what society values as important, like a compassionate response, a humane response. So values are really important in this discussion. And then the other part is about talking to people about what they're afraid of. So there are real fears for public safety and public security, and I think people don't necessarily understand that using drugs is not inevitably going to cause a public safety problem or a lot of disorder. So you need to work with the fears that people have, you need to work with values, and you need the evidence. So we've got the evidence,
right.
Now it's about working with people's fears.
Yeah. I didn't know whether to bring this up, I didn't know whether this was semantics, but I came across the importance of making that distinction between evidence-based and evidence-informed.
Yes.
Can you talk to me a little bit about that?
So evidence-based policy was originally came from medicine, where they were trying to teach doctors not to do what their gut instinct said, but to follow the evidence. So there was evidence-based medicine, that's how it began, and then people talked about evidence-based policy. But I think we've recognised that you need more than evidence. Right. So evidence-informed policy is the new term, and that recognises values and the importance of dialogue. And it's worth saying there's not necessarily just one right answer here. I think drug policy is complicated, and it's not easy, and it takes a lot of conversations to move things along.
Where have you seen the benefits of dialogue, of engaging in conversation, move the needle when it comes to drug policy?
Sure.
Have you seen that?
Yeah, so there's some really good examples from around the world. I mean, one example I would give is Ireland, where they held a citizens' jury. So a citizens' jury brings everyday people in, and they're given a whole lot of information. They get to ask questions, they have expert witnesses, and then they write a consensus statement afterwards about what the drug policy should look like. And Ireland has moved forward. They've also done it for abortion as well.
Wow,
in Ireland.
That's very progressive.
It's very progressive.
Yeah.
So there's Ireland. New Zealand has just had a process in relation to illicit drugs, where they've had a dialogue amongst everyday people. Because I think if everyday people can kind of better understand the issues, politicians are more likely to act.
What is it like in Australia, where you're based?
It varies. So we have one state in Australia that has effectively legalised cannabis, and they have also removed all criminal penalties for drug use. And that was the result of a parliamentary inquiry and a series of committees and a lot of dialogue, and that's currently being evaluated at the moment. In the state that I'm in New South Wales, we've just had a drug summit, but sadly the Premier on the first day of the drug summit said that he would not consider decriminalisation at all, and we weren't allowed to talk about it. So that was a way of shutting down public discussion and public dialogue, which was terrible for everybody.
How do you have a conversation about decriminalisation without shutting it down? But if you're still apprehensive, let's talk about how to have that conversation with many people who maybe are, who have a knee-jerk reaction to that word.
Sure, yeah. Absolutely. So the first problem is most people don't share a definition of decriminalisation.
Okay. Yeah.
So many people think it's legalisation.
Which is not.
Which it's not. It is not. It is not making drug supply legal. So that's the first thing. And in fact, these days, I don't use the term decriminalisation at all. I use the term removal of criminal penalties for drug use.
Which is far more accurate,
Which
right?
which describes what it is rather than giving it a label. And there are many ways in which you can remove the criminal penalties for drug use, but also by using that term, it becomes clear we're talking about drug use, not drug supply.
Right.
So from my point of view and the work that I do with governments, it's really important that police continue to have a role in managing drug supply and in arresting people who are supplying drugs and traffickers. That's a really important role. Right now they're spending all of their resources chasing people who are using drugs. If that was no longer a criminal activity, the police would not spend their time doing that, and they would shift their resources to drug supply and drug cartels and trafficking, because that's where all the violence and harm actually starts.
Right. Coming back to something you said a bit earlier about addressing fears. So that part of our conversation about the removal of criminal penalties for drug use, part of that conversation has to do with addressing fears. And the biggest fear you mentioned is that this will somehow jeopardize public safety, public security. Let's go deeper into that.
Sure.
Why is that the prevailing fear, and how would you address that?
Sure. Well, the first reason why people are fearful of that is because they believe that if you remove the criminal penalties for drug use, everyone will use drugs. So the only thing that stops people from using drugs is that it's a criminal act. Now, we know that that's not true. We know that people don't use drugs because they don't want to, because they want to look after their bodies, all sorts of reasons. So some people are afraid that public security will be damaged because as soon as you remove the criminal penalties for drug use, everyone will use drugs. Now, there aren't criminal penalties for alcohol use. Not everyone drinks alcohol. In fact, in here, a small proportion of the population drink alcohol. So criminal penalties don't stop people from doing things. So that's the first part of the fear. The second part of the fear, I think, is that there's not, unfortunately, people don't meet people who use drugs very often. I mean, I'm lucky. I get to spend a lot of my time with people who use drugs, and they're just like you and me. They're not scary or difficult or angry or aggressive. They're us. They're humans. And I think people are afraid that somehow, I don't know, people who use drugs will become violent or aggressive or cause trouble in the streets and so on. And there's no evidence for that. I mean, if you look at Portugal, they removed the criminal penalties for drug use. They didn't have an uprising of public disorder. They didn't have an increase in drug use, which is the other kind of fear. So there's not evidence that removing criminal penalties would do that. And I think if we can get more people who use drugs to talk to the media, to talk about their drug use with their families, because they're very hidden right now.
The other fear, if I may, and this is anecdotally, just from me doing my job talking to people, has been the way people view people who use drugs. It's almost like a moral failing. So the removal of criminal penalties feels they're apprehensive about that because there's this element of punishment. We must punish them for this moral failing. How do you respond to that?
So I think people have a right to have religious views and a view about what's moral and what's immoral. What we choose to call a drug is completely arbitrary. So let's take coffee. Coffee is a stimulant. Is it immoral to have coffee in the mornings? And does that therefore mean we should be punished? Nicotine is another drug that is commonly consumed. Nicotine is dependence forming, so is caffeine, the stimulant. What's the moral view about smoking? or about vaping, or about the consumption of any form of nicotine. And then there are other drugs that we use to treat health conditions. There are opiates that we use when someone is in an enormous amount of pain or experiencing persistent chronic pain.
Right.
Is that immoral that they are taking a heavy opioid, not dissimilar to heroin, to manage their pain? For some people, maybe that is immoral, but for most of us, that would be regarded as a sensible option to manage their pain.
That's a wonderful way of putting it. Thank you. I hadn't considered that before. You mentioned what we consider drugs. It's quite arbitrary. That brought to my attention also there's a rise of a whole generation of new and synthetic drugs, aren't there? Does that make the way we think about it, the current policy frameworks, the current research, does it make things more complicated with the rise of new synthetic drugs?
No, it's exactly the same. But I think what's different is that we're used to the old drugs like heroin, cocaine, and then more recently methamphetamines, and crystal methamphetamine in particular. But the way in which policy could better manage this is exactly the same as spice, synthetic cannabis, or any of the new psychoactive substances that we're now seeing, which are basically chemical concoctions that are synthetic. So the supply chain is different. They come from factories, they come from chemists who are concocting chemicals to produce a certain effect, as opposed to coca farmers in South America, or as opposed to the Harold poppy growing. So the source of the supply is different. But actually our policy response should be the same. Reduce supply, engage in law enforcement around trafficking, provide treatment, provide support, provide education and harm reduction.
So when you say the removal of criminal penalties for drug use, it would be then replaced with treatment and education. Talk to me about what comes into to fill in that gap.
So there are two debates here, two options here that countries face. The first is to say we're going to remove the criminal penalties for drug use and we're going to replace it with treatment. That's option one, and in a sense Portugal has done that with the commissions of dissuasion. The second option is to say let's remove the criminal penalties for drug use and not do anything. And many countries have done that because not everybody who uses drugs needs treatment. So a lot of people use drugs recreationally, occasionally, in non-dependent forming ways, in the same way as many people drink alcohol. Socially, but then some people do run into trouble. No question, there are people who run into trouble with alcohol, there are people who run into trouble with drugs. They need treatment. But to put everybody into treatment is not, it's expensive and it's not a good use of resources.
Okay, so how help me think through the
good
policy design, the trade-offs based on what we know.
Sure, there are trade-offs, So it all depends, it all depends on the context and the society that you're in. So what would work really well here is not the same as what would work in Portugal or Australia or Ireland or anywhere else. If you've got a really good healthcare system that already has a workforce that can work with people who use drugs, you probably need to put less into the treatment side of things because people, imagine a world where there were no criminal penalties for drug use and you could talk about it and you had a friend who was having a bit of trouble over the weekend. You would help them and take them to the local healthcare centre and say, I think my friend needs to talk to someone, we've had a bit of trouble over the weekend. And that would be perfectly fine, an appointment would be arranged, they would get education, information, and it would all be
fine and dandy.
That's right. But that means you've already got a good health system with a workforce of doctors, nurses, social workers who aren't don't discriminate.
Right, who have the capacity, to deal with. Okay.
And don't stigmatise someone who comes in.
Understood.
In places where you don't have that, and maybe that's not the case yet here in Malaysia, you might want to make sure everyone got treatment and set up special treatment services, community-based, to make sure that everyone had a conversation with someone about their drug use.
Okay, so it really depends on
entirely.
The context. When you mentioned some countries did this and some countries did that, so Portugal was one example that you said provided treatment. Which are the other countries that decided not to, and what were the trade-offs for not providing treatment? Yeah,
so Czech Republic is an example of a country, and there's a few other Eastern European countries that have done this. I guess the trade-off is that there will be people who will slip through the net and won't get the help that they need and may continue on with their drug dependence and experience a lot of harm associated with that. So really the question is, what are you valuing the most? Are you valuing ensuring that everybody gets a health response, or are you letting other parts of society, family, communities kind of pick up where the policing stops?
Okay. When you think about sound policy design around drug policy, what I mean,
well, it's all context dependent.
Correct.
So I can give you an example. I'm working in one of our states in Australia, Victoria, at the moment, and we've just designed a policy for the removal of criminal penalties, and we've got no action in that policy. So in that place, we're not choosing a mandatory referral to education or counselling or treatment. Okay. We're saying nothing happens.
So the onus is then back on the person who uses drugs to get help if they need it?
It's not an onus, it's
sorry,
a choice.
A choice, okay. Which brings me to my next question. People, the public, the media, policymakers, we have to undo and unlearn decades of indoctrination around the war on drugs. What would you say to our audience at home as well, and to me myself as I'm learning as part of this journey? How do we shift our mindset away from the punitive thinking, from the thinking about the war on drugs, that mindset that we have? What's the message if we want to move away from that narrative?
I wish I had the best soundbite for you. I don't know that I do. I mean, there's sort of two bits to it, I guess. The first is that everyone who uses drugs does not become dependent and experience problems. So remembering that. And secondly, the people that do become addicted or dependent on drugs need help and need compassion. And we know that there are really good treatments that work. And like with any other health condition, why would you deprive someone of effective treatment?
Professor Rita, thank you so much for being on the show with me, helping me think through some of these really nuanced discussions about drug policy. I appreciate your time.
My pleasure. Thank you for having me.
That's all the time we have for you on this episode of Consider This. I'm Melissa Idris, signing off for the evening. Thank you so much for watching, and good night.